This is a very difficult time for my family. Hello everyone, welcome back to my channel. This is Habiba. I'm very excited to talk to you today about what I am actually doing to stay safe during this coronavirus pandemic. So today I am going to be talking about my daily routine before I go to work and what I actually do if I have a COVID patient. And then once I get off work, when I get home, how do I manage my whole self, my everything before I step in my house to make sure everybody is safe. If you love my videos, you can stick around for more videos, motivational videos, tips, personal stories, advice, nursing tips, and all those fun stuff. So stick around, tell your friends, subscribe, and you are always welcome. Right now, what I actually do is standing for 12 hours. So you need a comfortable shoe. And when you get one shoe, you need another one. That one is not okay. You want another type of shoe. So I got to end up with 7 shoes. So right now, I picked the most comfortable and the least expensive shoe. I kept the other ones away, so I only wear one pair of shoes to work since this pandemic happened. I stopped taking my purses, my extra stuff, like things that are not important that I take to work and put in my purse and put in my bag and all those things. I put them away. I don't have a need for my purse at work. I put those things in my house. So I have a folder that has most of the files that I need. I have a little box that has a divider inside it. I put things that I need for my patients. I put them inside the box. I keep that at work. I keep the folder. I keep it at work. I don't bring it home. I don't take it to my car. I just leave it at work. Once is my shift, I go there, pick it up from my locker, and the day begins. We have a storage where we keep things that we use for the patient. There is a Ziploc in the storage. So I go to this storage, pick up a Ziploc, put my phone in the Ziploc at the beginning of the shift straight. So if I need to use my phone, and trust me, despite that my phone is in the Ziploc, I'm still able to use it like that. I feel like I'm safe because our phones keep a lot of bacteria that we're unaware of. We put it in our ears, we put it in our mouth, like talking, and yeah. So I try to put my phone in a Ziploc. So with that, I know that my things are not exposed. Talking about if I have a COVID patient. First thing, we are trained nurses. We know how to wear our PPEs. Meanwhile, my job has an educator. She came to the unit. She revisited how to put PPE on, how to put face mask and all those things to gown up, and how to get ready for protection when you have a COVID patient. So we were made to use N95, then normal face mask with a face shield. Before I go into a COVID patient's room, I check the medication, I check the MAR, make sure that I have all the medications the patient needs. I work on the tele unit. I check from the monitor tech and make sure the leads are on and everything is perfect. If the leads are not on, if the leads are not placed properly, I take a couple of extra leads. I take the vital machine with me while I'm going in the room. I get my prepared questions ready. In case the patient has any question, I don't get freaked out because I don't know what the patient is asking me. So I go through the patient history. I know the patient's story. So when I get into the room, I check the orders and make sure that I am able to answer the patient's questions properly. If my patient is on any IV medication, I take IV tubings with me. If my patient has any pending labs, I get the tubes ready before I go into the patient room. If my patient is not an NPO, I take a cup of ice chips with some ice water to go with me to the room. I take some extra juices, some like snack, cookie, crackers, sandwich. I make sure that I stock my table. If I get from the report that my patient is incontinent and they're on condom cath, I take some extra condom cath with me, check the patient and make sure the condom cath they have on is intact. Just place a new one if it's not. If patient is continent, I give them a urinal if they can walk to the bathroom by themselves. Mostly COVID patients are not able to walk to the bathroom because they're weak and they're in pain. So I give them urinal to use in bed. I do a quick education, pass my meds, do everything I need to do real quick. Everything that I mentioned is not like I'm not taking so long doing all these things. I do them boom boom boom. Hey Mr. Smith, hey, my name is Habiba, I'm gonna be your nurse today. I'm just coming in to get report. I don't know so much about you, but I'm gonna try my best to answer your questions today. Can you tell me what your name is again? Your date of birth? Do you know where you are? Do you know the president of the country? And all those questions. You just make sure you know the patient's, if the patient is alert and oriented, and what's the level of orientation. So you can put that in your documentation to affirm what the reports that you got says. And after that, you let them know you have medication for them. Do you need this? Do you need that? I have cookie crackers. I have some ice water for you. You just try to be as nice as you can. Don't make this patient feel like they're isolated. Don't make them feel like they're rejected, because I believe anybody can go through this, and we just have to work together to make sure they feel better. While doing this, don't expose yourself. Remember, you don't touch your face while you already have your face mask on. Try to cover up. Try to not be so nice and forget to put on your glove. And there's no emergency in pandemic, so protect yourself as much as you can. Try to stay safe. Remember, you have families. Remember, you have your life to live. And remember, you're here to save lives too. As much as you can, try to stay safe. If anything bad happens to you, you're not going to be there to help anymore. So remember that every time, and always try to be safe. Cluster my care and put all these things together before I go into my patient room. So, because I don't want to be running back and forth if I need something. Meanwhile, I have my CNA's phone number. We always have phone numbers of our staff. We all have little baby phone that we put in our pockets. So if I need something, because I don't want to keep spreading this, so I call a charge nurse to let him or her know that I need something. He brings it through the door. I get it and rush back into the patient room. We keep these patients in negative pressure rooms. In isolation, we use at the beginning they said patients are airborne, droplets, and contacts. Now they say patients are only droplets in contact. So we don't need N95 anymore. Talking about 6 feet. Okay, so I've tried this a lot of time. It did not work out for me. I cannot maintain 6 feet when I'm ready to give my patient an IV medication and I'm ready to push something through the IV. I have to hold my patient's hand to push medication through the IV. So there is no way I can maintain 6 feet with the patient. The only thing I can do is make sure my patient's face is turned to the other side so they can breathe to the other side and not straight to my face. That's the only thing that I always do. Like, Mr. John, can you please turn your face to the other side? I'm ready to give you some medications. Yeah, like that. Just make sure they understand their diagnosis. Make sure they know this infection can get to anybody through breath. So you don't even have to cough into people's faces. That's why they said social distance. Well, I'm taking care of you. I cannot maintain social distance. I have to be close to you because I'm wiping you down if you mess up your bed. I'm giving you IV medication. I'm giving you medication in a medication cup. And I'm passing water to you. I'm doing so many things to help you stay strong and to help you stay healthy. So in that case, you should be ready to help me too, not to get sick. So because I don't want to keep going back and forth into the patient room, I make sure that I check my patient's IV site. Make sure the IV is not infiltrated. If I need to fix another IV, I do it right there before I leave the room. I'm doing this because I know that I'm rest assured if my patient goes into code blue, I have a stable and ready to go IV to use for the process. And I make sure that I have 20 gauge, 18 gauge in case I need to transfuse. I don't want to be going back and forth in the room. That's the major thing that I'm saying right here, because if you have 24 gauge and you have 22 gauge, I will be ready to give you a 20 gauge or 18 gauge before I leave the room. Get it done, get it out of the way, and that's it. At the end of all this, let the patient know I'm not going to be coming to your room every now and then. I'm going to ask you, do you need any other thing before I leave your room? Is there something that I need to get for you? Do you need another cup of ice? Do you need this? I'm just going to give options of what the patient might be asking me for. Because trust me, I've had a patient that is a COVID patient, and this patient is aware of the diagnosis and how transferable this disease, this infection is, but will not stop calling. In that case, when the patient is calling me every 5 minutes, I don't want to be in your room every 5 minutes. I'm sorry, I love my job, I love you, I hate to see you sick, but I don't want to be sick. That's why I'm here, to take care of you. And if you get me sick, it's not gonna be fair. So I try to educate my patients and let them know their diagnosis, and I'm not gonna be coming in your room every 5 minutes. Do you need anything right now? Let me know so I can get it for you. If I'm not able to get out to go get it, I'm going to call somebody to come in and give it to me through the door. Give it to you, and then we'll call it a day. If you have any emergency, I have a call number. I put it on the board. I update my board. Everything is set. Call this number. If you're not able to get to me, call my CNA. She'll come to you. If she's not able to get to you, this is the charge nurse's number. The charge nurse will come to you. I just give them options for not calling me throughout the shift. If I have a patient with lots of medications that are like not together, different time, like one is 9 p.m., another one is 10 p.m., another one 12 a.m., another one 2. No, I call the pharmacy and let them know, can you please put all my medications together at one time so I wouldn't have to go back and forth in the room. I'm not asking for this just only because of myself, but because going back and forth, I'm opening the door, the air from the room is coming out, and I'm taking this same body to another patient room. And most of the time you have older patients that are like higher risk of getting this COVID virus, and you leave a patient that is positive to another patient that is negative. So you have a risk of giving it to the next person. Once I step out of the patient room, the proper way, taking off PPE, I take it off and put it in a clear plastic bag. The only essential thing that I take to work with me is my key, my keys, my car key, my house key, and I take my state ID or my driver's license. I take my debit card with me in case I need to get something. I don't take no cash around because I believe money will carry this virus. So I try to be as safe as I can. Put all these things in a Ziploc and zip it. Leave the things that I can leave in my car, leave them in my car. The ones that I can't leave in my car, I take them in my with me and put them safe in my locker at work. Once I get off work, I have a spray in my car, and this spray is Lysol spray. It's a disinfectant spray, and I have a Lysol wipes, the bleach one. I have that in my car. Some nurses will use the bleach from work, the wipe bleach from work. They use it to wipe their shoes before they leave the unit. But I don't see the reason to do that, because you're walking in the unit, going to the elevator, walking down to your car, and you don't know who spit. It's a couple of times you walk and you see people spit on the floor. You're stepping on those things, and You think you're fine to get into your car? No. I get to my car, use my spray, spray the whole of my shoes, and get into my car. After I'm done with that, I actually just make sure my leg is like outside hanging out, and take my spray and spray it real quick and get in. So, and that's it for work. So when I get home, my shoes, I have a clear plastic bag in my car that I take with me to get inside the house. So I take off my scrub outside before I get in. Take off my shoes. I don't make sure that I don't take my shoes in the house. So once I get home, I have Lysol spray outside. I'm gonna be touching the knob to open the door anyway. So I announce to everybody, hey, I'm home. So they pave way for me to get home because my scrubs are in the bag, plastic bag. I tie that out. I tied it up, put it outside. My shoes, put it away somewhere because I just let my kids know you can come close to me. No hugging, no hey mommy, no welcome mommy. He knows. My Lookman knows that he's not supposed to come close, and the little ones also know they're not supposed to come close. So they stay away as much as they can. So being that he knows a little bit about coronavirus, he knows how it's transmitted. I give him education. And he knows to be careful around me when I'm just coming back from work. I try not to touch so many things. I have a hand sanitizer, sanitize my hand, go straight to the bathroom, take a shower. I try to wash up as many times as I can, wash the most exposed parts of my body as much as I can. Do the showering. After I'm done, I go back to my Ziploc, take it out. I have to spray. Despite that I didn't bring out my phone from work, I still spray my phone and my car keys and my keys, everything that I took outside the house with me. I spray with alcohol-based spray or sanitizer or anything. I have a couple of them in the house. I just use whatever I'm able to get hold of. I try to wipe down the surfaces, like any surface in my house, just everything in general. I just make sure everything is intact. So washing my scrubs, take them off the plastic, put them in the washing machine, put a little bleach that is not gonna take off the color of my clothes. Make sure that I wash separately from the other clothes. And once I'm done washing, I try to spray the washing machine with bleach spray or whatever, something that I can use to disinfect the washing machine and make sure that any other person is not getting the virus from my scrub. Before I wash my scrub, I put on gloves first before I open the plastic bag. Once I'm done, I take off my glove and dispose the glove in the garbage bag. That's it. Just make sure that everybody's safe. Every time I come back home and I'm done with all those crazy things, crazy cleaning and wiping down that I do, I taking shower, I just go straight to the kitchen, find something to quickly prepare. I still say hello to my kids. I still say hello to everybody. But right there, it's not that I've infected or anything, but I just don't feel comfortable hugging them. This is really sad because I want to hug my babies. I just do a quick hello, grab something to eat, quickly go back in the room, lock myself in. And my husband is very supportive. He helps me a lot because everybody's not sure what is going on. We're just making sure we're all safe. And that's what I do before the beginning of the next shift. I just stay in the room. I eat only once because my night is my day and my day is my night. I only eat once before I go for the next shift. And overnight I eat like 3-4 times. So I eat like 3-4 times before the end of the shift. So because it's my day. My little baby boy, I call him and remind him of sneezing etiquette. Silly boy. About sneezing get out. I call him and remind him about sneezing etiquette, sneezing your elbow. Don't sneeze in people's faces. Cough in your elbow. Don't cough in people's faces. Don't hug anybody. Don't shake people's hands. Don't be too close to people that you see the coughing or sneezing or have symptoms of a couple of COVID virus symptoms that I showed to him. He already knows. But the little 1 and 2 year old, I'm very scared for them. But yeah, I hope they understand. It's a very difficult time for me right now because I'm not as close as I want to be with them. So at the end of the day, I go back to work. Before I leave home, I take the Lysol spray the room that I've been in all day, spray the room with Lysol before I go back to work so everybody can feel safe again. So that's how I try to play safe during this difficult time. I hope we get over this. I hope this ends very soon, able to go back to our normal lives. And I hope we stay healthy. Wash your hands, use hand sanitizer, stay away from people. Government says stay indoor. Stay indoor if you feel like you're exposed. Stay in for 14 days. That's not gonna do nothing bad to you. It's not gonna kill you. 14 days. Just comply with the rules. Stay indoor for 14 days, and that's it. And after 14 days, you can be free again. Government says stay indoor. Please stay indoor. Try to stay safe. Thank you so much for listening. Thank you so much for following the rules. Thank you for keeping us nurses safe while you're keeping yourselves safe too. Peace.